Welcome to another episode of Healthy Options. This time we have, by popular demand, a guest come back, as well as a new guest. We're going to be talking about some technology that helps to solve all your problems very simply. So, first of all, I'd like to have the guest. We have with us Dr. Paperny and Dr. Sakai. And I like to use just their names, David and Carolyn, and rather than doctor. So, David, could you give us Carolyn, let's start with you. How about a little personal background? We'll move to David, and he can start talking about what we're going to talk about.
Well, I met actually David when I was a chief psychologist at Kaiser. I worked for Kaiser Behavioral Health Services for 31 years, and then I retired in 2004 and have been doing a private practice. And I've been working with thought field therapy for the past 11 years.
Great. David?
And I'm a pediatrician at Kaiser who does behavioral health and behavioral pediatrics for the last 30 years. And I've been working with Carolyn and others in other energy modalities. And this has been a particularly amazing application of therapy that crosses a lot of boundaries. Very excellent.
So we're talking about thought field therapy.
TFT.
TFT, okay.
And I got to say that Carolyn is probably the singular master in Hawaii, and one of 7 in the world. So just to give you the credit where it's due.
Oh, great.
So for a little bit of background on thought field therapy, let me just show you the first slide that kind of explains a little bit about, basically thought field therapy is a form of mind-body connection, and it is a precision therapy which is used actually to address the balance between acupuncture meridians that affect emotions. It's well known that acupuncture can do a lot of physical things, pain things, body healing, as well as emotional impact. So this is a empiric approach to a precision therapy that's using the acupuncture points without needles and individuals to treat a whole variety of different conditions, including a variety of issues, including fears, anxieties, and phobias. And it's very well known to do a very good job. In fact, some of the applications which it's particularly useful for include a variety of mood disorders, fears, obsessions, angers, even addiction. And it has lately been applied to a lot of other areas which may surprise you. The technique is very simple, actually. The technique is where one focuses their attention on the thing or the stimulus or the issue that upsets them the most, keeps their focus on that thing that causes the fear or the anxiety or the negative reaction, and then simply presses and taps, or rather taps on various acupuncture points in very specific order, in algorithmic order, in order to treat the situation, and does some other operations at the same time. And these acupuncture points were actually evaluated statistically to become algorithmic, where very specific ordered points are tapped on by the patient, as seen in this slide, where they're tapping on the hand. A lot of the points include the face and other parts of the body, which is a way of balancing the acupuncture points or doing a sort of acu-tapping of the emotional points. And what it does is pretty astounding. It actually allows some of these issues to literally become harmless and almost instantaneously. And that's why I was so impressed with this, because it seems to disconnect the emotional component from the memory or the image that somebody may retain. Whereas if somebody had a trauma and they remember brake lights and a crash in a car, or they remember a gun in their face and they have a phobia of certain things because of this memory or this image, it seems to take that emotion and kind of neutralize it, and it becomes obsolete. And so what we've found is that thought field therapy seems to use much less clinical time. Instead of sitting on the couch and talking to a therapist for days and hours and many sessions, in 1 or 2 sessions, thought field therapy usually has amazingly good effect. And it can often reduce symptoms to almost half in a session or 2. And so because of this, we studied it kind of in depth, and we wanted to be sure that we were doing things which are scientific in this regard. So when you measure blood pressure and pulse, and you even look at heart rate variability, which is one of the very best measures of the level of stress of the autonomic nervous system, the change in heart rate variability is very obvious. And on the left side is before thought field therapy, and on the right side is immediately after the tapping thought field therapy. And the difference is astounding. And just to let you know that this variety, this widening of the curve and slightly lowering of the trend is a very positive effect that it has. So it has been very successful. We actually studied this in 700 patients with about 2 sessions each, where we evaluated it in terms of the pre and the post levels of distress, as well as looking at symptoms before and after treatment. And 80% of the time, there was a significant decrease in the levels of distress in 1 session, which is pretty astounding. So people ask, you know, how does this work? What does it do? And is it scientific? It seems like magic, but it's not magic. It's actually very much like acupuncture. And acupuncture has now become a totally accepted medical treatment for back pain. It was published in Annals of Internal Medicine last year that it is the #1 priority treatment for back pain. So this is another approach using those acupuncture meridians. We have to admit, we can't say for sure we know exactly the mechanism. It's fair to say we don't know how aspirin works either. So, but empirically we know this works. The question is, it has raised speculation as to what is it about acupuncture and tapping and thought field therapy that makes these changes. And so maybe Carolyn can help us with that.
Well, I have a few questions.
Yeah.
One, now you say after 1 visit, there was an 81% decrease in distress. Now, does that include the person practicing on himself, going through these points?
Actually, everybody does it to themselves,
Right.
pretty much. People, yeah.
So what I'm asking is that they've learned it in 1 session. How many times does a person have to do it to themselves so they really start to see results?
Once or twice.
Oh, that's it.
And then that's like, you can actually make changes almost immediately. It's almost like it just rebalances your meridians somehow. It rebalances your emotional balance in an energy system.
So you don't have to keep doing it to yourself.
But there is a maintenance switch.
Yeah, and it may depend on what you're working on.
Okay.
If you're working on a phobia or a trauma, a simple trauma, it may be 1 time and that's the symptoms are remitted. If you're working on like anger and rage issues or anxiety, chronic anxiety issues, and stress that you keep having more stressors, you have the self-treatment so you can keep repeating the treatment whenever you need to.
Great. Okay. So 1 visit with a professional teaches you how to use it. Then you go on, and you can really use it for other problems, other situations. I mean, is there any downside? Is there any negative side effects?
There have been no negative side effects, and it's been used since Roger Callahan, a clinical psychologist, developed it about 30 years ago.
Oh.
And no known side effects that were negative.
Maybe bruises on the head from
If
too much
they're
pounding?
tapping too much. But it's gentle tapping.
Okay.
And in fact, people can do it imaginally. Once they know where the treatment points are, we have people who are doing it just focusing on the treatment point.
Without touching the points, they're just imagining
That
the
is
points.
a possibility.
Wow.
In some cases, you just focus your attention and imagine that happening, and you're sending your energy there just as many other processes.
Wow, that's amazing. Well, what else do you have to add, Karen?
Well, it's been something that I found fascinating using in clinical practice, and I am training people. Both I have lay people that I train in a half-day session so they can learn self-applications. And we also have a 2-day professional training where we're teaching people to use it to apply to others. And this has been a godsend for us when we've gone on trauma relief missions to third world countries. I've been to Rwanda 4 years in a row, and we can go in, show them how the therapy works. Once they're aboard and they want to learn this, we can train their community leaders and their therapists, pastors, teachers, so that they can actually learn to do it and practice it on others. You saw in the slide a minute ago, this is in Rwanda, and we're actually at the Zeri Center, and it's a rural area, so you can see a rooster and cows in the background. But this is one of our newly trained therapist who's working with one of the people in the area, and they had very good success with working with
You know,
them.
I had heard a story from David about an orphanage that sounded really amazing. Was it?
Yes, we worked with an orphanage. We worked with 400 orphans there. We worked with them individually, the more severe genocide survivors, and then we worked with the others in groups, but with very good results. We have the results that we are now submitting for publication.
Well, the part that was interesting to me was that the challenge was so massive with so many children that you were really concerned about coverage, and that I had heard the kids were teaching the kids.
Yes.
I mean, they just did it spontaneously.
It was just amazing. And when we went to the 1-year follow-up, we were just amazed because they looked as good as they did at end of treatment. And we were finding out, because we went deliberately at the anniversary of the genocide, because that's when they're
Emotions might come up.
Yes, and they're having like a 2-week where they just focus on the genocide and focusing on the activities about hoping this would never happen again. And so they're having that constantly brought to their minds. So they're having the memories. And what the kids were doing was that if they woke up in the night with a nightmare or they had thoughts about it, they would start tapping. And some of the kids said they started tapping. And then there were a few other kids who would be waking up with nightmares and they'd all be tapping together.
Oh, wow.
Yes.
That's amazing. Now, for those who are not aware, in Rwanda there was a conflict between tribes. And
Yes.
there were 1 million people. One tribe killed the other.
Yes, almost 1 million people.
Yeah.
Well, actually, killed within 90 days.
It was amazing. That's
And they were horrendous trauma stories. And we actually were using interpreters because they're speaking Rwandan. And the amazing thing is we're getting secondary traumatization, more so the interpreters who are hearing some of these stories. And the beauty of the thought field therapy is because we're showing them how to do the treatment and doing it alongside them as they learn the self-treatment. The interpreter is doing it also. So we were treating our secondary traumatization simultaneously. Yeah.
You know, we have a little clip of a movie of your translator, which we could show if you want.
Yes.
Okay.
Great.
Shall we go ahead and show that clip then?
That's a good idea.
Yeah.
I couldn't talk about this before until I was treated with the TFT. Thought field therapy. You can't believe this technique. When I heard about this the first time, I thought, oh, man, this is witchcraft. It's crazy. It's just you need to tap on somewhere in your body and you are healed, you are cured. I could say this is crazy. I was invited as an interpreter when a team of 6 people came to train 33 therapists in one of the neighboring villages. I didn't know that I could be involved in TFT. When they said, is there any person who think that we should work on something, or is there anyone who has a problem that we should work on? I was the first person to raise my hand because I had these bad memories that I had for 15 years, and I have never told this to anybody before. I went in front for treatment. I just said, okay, let's go and try it. I know it will not work with me because I knew my problem was so serious, so to the extent that it couldn't be treated with TFT. During the time when I was remembering about what happened to me and all I went through, my face was dark, angry. But at the end of the treatment, I was looking so handsome. But for people who have been to school, you say, have you ever heard about TFT? And so I'm going to try it, and I really believe it will work. And they can't believe it. They say, oh, but this man must be crazy. Just tapping someone in your body and you are cured. No, we can't believe it. But I'm a witness. That's why you can see me smiling. You can see me. You see, I'm handsome now. I'm okay. I can talk about what happened to me. But before, I couldn't talk about it.
Yes, he was actually, when we first got there, he was, one of our team members asked him about if he had been in the genocide, and he said, I can't talk about that. And we're looking at, oh no, he's going to be our interpreter, so we need to work on things. So I asked him if he would be willing to work on it. He said, it's so bad. He was 10 years old. He said, it's so bad. I know it won't. I can't even visit my home village. So that was and he's really blossomed. You see, he's now teaching others TFT, helping others with TFT.
That's terrific. You know, I noticed you had a few more slides that you had brought. Did you want to cover that?
I did want to explain about the rapidity of the thought field therapy a little bit more than what Dr. Paperny had mentioned about the speed with which this works. Dr. Charles Figley and Joyce Cabernell, who were at the University of Florida Trauma Treatment Center, had done a little study where they looked at different therapies, traumatic incident reduction, TIR, and they looked at the length of treatment time was 254 minutes. For eye movement desensitization reprocessing, EMDR, 172 minutes. And VKD, visual kinesthetic dissociation, was 113 minutes. And thought field therapy was 63 minutes. And these are all much faster than the more traditional therapies, which I have done for most of my career before I learned thought field therapy. Right?
Exactly.
Well, so even the other neurotherapies.
All of these are physical modalities that people do or with their eyes and so forth. And in the thought field therapy, it's the tapping on the acupuncture points, but they're more physically oriented than talk therapy.
Yes, it seems like with it can speed up things. Exposure therapy has been used for a long time with PTSD, and this is actually with activating the meridians that allows the body to relax. And you have seen the acupuncture study you might want to mention with that.
Yeah, clearly acupuncture was shown that it's medically indicated for back pain. And it's almost the number 1 or 2 treatment. And you know, what I wanted to suggest is that we are used to going to the doctor and talking to a therapist and taking Prozac and taking a variety of drugs, and that's our Western approach. Probably more in the East, more people in the East get medical care using the energy meridians and acupuncture treatments than Americans do the Western, if just look at the population. Right. And the success of this over 4,000 years speaks clearly that we're now adopting these Eastern techniques, and thought field therapy is really probably the first inroad into this. And just the fact that it's so much faster speaks orders of magnitude about costs and our healthcare system and what we can accomplish if we use these kind of therapies. It takes a month before Prozac starts to work. It takes months or weeks before sitting on the couch therapy, talking out sessions work. Hypnotherapy for certain things is good. In a number of sessions, it takes a lot of repetitive work. But the fact that this energy balancing mind-body approach actually effectively works within 1 or 2 sessions is a cost benefit that's beyond belief.
The thing that's really great to me is that there's no licensing, I mean, if kids can teach it to each other, I mean, that shows you how easy it is. And I mean, it would seem that this would be great to be taught in schools or, churches or, everywhere, really.
Yeah. Harmless, no needles, harmless, no equipment, and no drugs.
Right.
And we can use it for everyday use. Once you have learned the treatment, you can keep applying it. You can use it for things like reducing your frustration and anger, stress, anxiety, worry, when we obsess about things. It can reduce sadness and excessive prolonged grief. It can work with chronic pain. One of our first advocates was within the Kaiser system as working with the pain clinic. And it can reduce cravings or addictive urges. And we can also enhance concentration, focus, and performance. We can actually enhance performance. So you don't actually have to be impaired or sick to benefit and get better. And that's why we're teaching like personal empowerment seminars where people can actually, who are even well and healthy, get even better. It's being used by people to enhance performance in sports, public speaking, competitions.
Now, how would you, I can imagine how one would think about, I'm scared of snakes, and then, tap and maybe change that phobia. In terms of being successful at an activity or business or what have you, how do you set that up?
If there's anything that gets in the way, like if there are obstacles, then we work on the obstacles. Like if they have something that gets them frustrated and angry or stressed, then we would work at bringing that down. And then once that's out of the way, any barriers are out of the way, then we would look at working with a process called peak performance, which is part of thought field therapy. So there's a 1-2 punch. One is bringing down any distress or anything that gets in the way of our maximal performance. And then the second punch is peak performance. So you can get in the zone and stay in the zone.
You saw that graph that shows you're more in the zone with
heart rate variability. So peak performance, I'm still a little bit unclear in terms of how one would see that, or obstacles are easy to see.
Right.
And so peak performance is almost like an unknown in regards to somebody's vision. I mean, that's something somebody's seeking.
Well, if the person knows what the performance should feel like if they're playing golf, and you know what that drive should be like,
right,
and you know what that stroke feels like, you have that body memory, then you would be visualizing it and bringing in all the sensory modalities.
Okay.
And it's kind of like they're actively being in a movie as they do that, and enhancing it and anchoring it with the points. And it actually has people being able to enhance their performance and raise their confidence level.
Interesting.
Performance anxiety, test anxiety, perfect.
Oh, yes, right.
And then you add visual imagery and hypnosis like we spoke about before, and you really have peak performance. When you eliminate the obstacles, get the body's physiology tuned in, get the mind tuned in, that's peak performance.
Wow, that's terrific. How does somebody get involved? What do they need to do? What are the resources?
Well, we have over 75 therapists who have been trained with this on Oahu, and about 25 on the outer islands. And people who have can also take the courses. I do the thought field therapy for personal empowerment classes periodically. It's on my website at www.tftcenter.com, and the classes are listed there. For people who want to work with others, they can take the longer 2-day training. I also teach some advanced trainings, and they're all taught here in Honolulu, or they can be arranged on demand, like on the outer islands, or I've gone to some places on the mainland, and of course we've gone to third world countries that need it, and we volunteer to train them.
David?
I was just thinking how it's really almost sad that America doesn't use these kind of technologies, and here the third world countries are using them to such a great extent.
Right.
But people can become aware of this simply by, if you want to just Google Whoopi Goldberg, fear of flying using TFT. It shows a whole operation where she's in an airplane getting rid of her fear of flying using TFT.
Wow.
Carolyn and I were thinking we should load a Hawaiian Airlines plane full of local folks who have fear of flying so we can fix it in an hour and go on a flight. That would be a good lab.
Wow.
But it's a very...
Do it before you take off.
Yes.
Yes.
But hers was actually simulated, but it's right on YouTube. It's very interesting to watch that.
Wow, it's amazing.
Whoopi Goldberg, TFT, fear of flying.
Now, one quick question. We only got a short time. I've heard of other similar type therapies. What's the difference?
Oh yes, there are offshoots of thought field therapy. Roger had trained a number of people who went off to develop some of their modifications of that. One that is probably most widely known is EFT, Emotional Freedom Technique.
Mm-hmm.
And Gary Craig, who developed that, was trained by Roger Callahan.
Oh, okay.
So it's a modification.
Okay, good. So, I mean, this sounds, in a way, too good to be true as far as being able to get rid of stuff in a very short period of time.
That was my first impression too. When I first was starting to look into it, I looked into thought field therapy because I was looking for something that would work, that would be quick, and that would empower our patients and clients to be able to use it so we can actually shorten the therapy time. Mm-hmm. When we started behavioral medicine at Kaiser. And when I first heard about this, I thought, no, that couldn't
Can't
be.
Yeah.
So I went to check it out because I thought, well, I'm desperate to find something. And it's actually improved my personal life as well.
Great. Well, that's the best testimony.
As soon as Carolyn trained me, I went back to my clinic, and my nurse said she hasn't swam for 10 years because of a near drowning, and we just did it, and she went swimming the next day. And another nurse the next day had told me the same thing.
Wow.
And it worked just like that. And I'm going, the skeptic is gone.
Wow, that's great. Well, we have just a little time to wind up. I want to thank the staff at Pololo Olelo for all their help in setting up. And as usual, they've done a great job, and appreciate our guests, David and Carolyn. Get more info on TFT at tftcenter.com. So thank you, and we'll see you again in the next episode of Healthy Options.
Aloha.